Hello everybody, we are going to be getting started with the respiratory system, which is chapter 3 in your book. I just want to make a note that for different slides I'm going to be saying highlight star before I start, and in that slide basically is something that's going to be on your test. It's not everything, it may be just a small piece, but I just want to make sure that you are informed of that. Alright, so this is a highlight star even though it is review. The respiratory system has two major functions, ventilation and diffusion. Ventilation is moving air in and out of the lungs, while diffusion is exchanging oxygen and carbon dioxide between the lungs and bloodstream. The upper respiratory system includes the nose, mouth, pharynx, and larynx. The lower respiratory system includes the trachea, bronchi, alveoli, and lungs. This is also a highlight star. The thoracic cavity contains the right and left pleural cavities and the mediastinum. The pleura has two layers, which are the parietal pleura and the visceral pleura. The mediastinum is divided into three parts, anterior, middle, and posterior. I want you to review the thoracic cavity and the enclosed body structures. The bony thorax provides protection and assists in breathing. The paranasal sinuses are also a part of the respiratory system, but not in the thoracic cavity. Alright, so for radiography, chest x-rays are the most common radiologic exam and a critical diagnostic tool. We are typically doing a PA and a lateral chest x-ray. We want to reduce heart magnification by positioning the patient closer to the detector. We also, if we have prior imaging, it is nice to have that to be pulled up. Things that can change our exposure would be soft tissues like breast shadows or muscles. And then we also have like bone differences, so like fractures, scoliosis, and deformities. There can also be additive and subtractive pathologies. So for example, if any condition that adds fluid or tissue to the normal aerated chest, like pneumonia, that would require us to increase our technical factors. On the other hand, if we have any condition that increases aeration of the chest, like emphysema, we would want to reduce our exposure factors. Computed tomography, or CT, is another modality that can be used in diagnosing diseases. CT is far more sensitive than X-ray and can detect diseases earlier. It produces thin slices, which are 1 to 1.5 millimeters. It evaluates nodules and embolisms. The rule of thumb for nodules is if it is less than 1 centimeter, it is likely benign, and if it is greater than 1 centimeter, it is possibly malignant. They can also do needle biopsies and aspirations in CT. This is another highlight star. So tubes, lines, and catheters, we are constantly taking images of those things when they are placed. So first one is endotracheal tube, or an ET tube. This is a large plastic tube inserted through a patient's nose or mouth into the trachea. It helps to manage the airway and allows for frequent suctioning or mechanical ventilation. A chest tube is also known as a thoracostomy tube. It is a flexible plastic tube inserted between the ribs and into the pleural space. A few other tubes that we have are central venous pressure, CVP lines, pulmonary artery catheter, intra-aortic balloon pump, access catheter, and a ventricular pacing electrodes. This picture is demonstrating a portable AP chest x-ray with an intra-aortic balloon pump placement. And these are portable chest x-rays taken after a pacemaker insertion and demonstrating proper placement of lead wires, which are indicated by the arrows. Respiratory failure occurs when the respiratory system fails to properly exchange oxygen and carbon dioxide. This can occur within the lungs or as a result of impaired breathing. Hypoxemia is a result from low oxygen in the blood. Hypercapnia is the failure of ventilation resulting in the inability to move air into and out of the lungs. Symptoms for respiratory failure include rapid or irregular breathing and a paradoxical abdominal motion. ABGs, or arterial blood gases, are the primary method for diagnosing respiratory failure and for determining the severity. Chest x-rays are used to help identify the cause of respiratory failure. Treatment can include establishing a patent airway and administering bronchodilating drugs and controlled oxygen therapy using specialized non-ventilator masks like a CPAP or a BiPAP. Alright, so for congenital and hereditary diseases, this is a highlight star. Cystic fibrosis is a genetic disease affecting exocrine glands that cause thick, sticky mucus and leads to airway obstruction and infections. Symptoms include a chronic cough, wheezing, and frequent infections. Progression would be bronchial damage and leads to obstruction and then the infection cycle. Cystic fibrosis is an additive disease over time, so we would have to increase our technique. This is another highlight star. Cystic fibrosis is most commonly a genetic disease in white children. Chest x-rays aid in diagnosing cystic fibrosis, which make them the modality of choice for evaluation of the disease. They can be taken over years to determine the worsening of the disease over time. Treatment for cystic fibrosis would be antibiotics, bronchodilators, and respiratory therapy. This is another highlight star. Respiratory distress syndrome, or RDS, is seen in premature infants, which leads to alveolar collapse. The incomplete maturation of the type 2 alveolar cells within the surfactant-producing system causes unstable alveoli, the structures in which gas exchanges occur in the lungs. This results in hyaline membrane disease and RDS, which is best evaluated by a chest x-ray. Signs include rapid and labored breathing within the first 24 hours of being born, with atelectasis and respiratory failure progressively getting worse. Treatment includes oxygen support and surfactant production, usually begins after a few days. Once the surfactant is present, RDS will resolve in 4 to 5 days. Chest x-rays can demonstrate a severe atelectasis with a bronchi surrounded by non-aerated alveoli. Alright, now we're going to be moving on to inflammatory diseases. This is another highlight star. Pneumonia is the most common lung infection. It is the leading cause of hospitalizations and it is the most lethal nosocomial infection in the U.S. The main causes of pneumonia are bacteria, viruses, and mycoplasmas. Bacteria commonly responsible for typical pneumonia include Staph aureus and H. influenza. Symptoms include a fever, cough, and sputum. There are different types of pneumonia, which are lobar pneumonia, staph pneumonia, Legionnaires' disease, mycoplasma pneumonia, aspiration pneumonia, and viral pneumonia. This is another highlight star. Pneumococcal pneumonia, or lobar, is the most common bacterial pneumonia and is generally preceded by an upper respiratory infection. A chest x-ray would demonstrate a collection of fluid in one or more lobes. Pleural fluid may be seen in the lateral decubitus projection of the chest rather than an erect lateral chest x-ray because smaller amounts can be detected better. Treatment includes antibiotics and bed rest. These images are demonstrating pneumococcal pneumonia infiltrates in the upper lobe of the right lung indicated by the arrows. Alright, this is another highlight star. Legionnaires' disease is an inflammatory disease of the respiratory system. It is caused by Legionella pneumophilia, which is spread through inhaling the bacteria from water or soil. Patients will experience malaise, muscular aches, chest pain with a non-productive cough, and occasional vomiting and diarrhea. Treatment consists of antibiotic administration and oxygen therapy. This chest x-ray is demonstrating Legionnaires' disease. This picture is showing rounded opacities in the upper half of the right lung and lower 2/3 of the left lung. Aspiration is a type of chemical pneumonia and it is caused by acid vomitus in the lower respiratory tract. This can happen after anesthesia, alcoholic intoxication, or stroke that causes dysphagia or loss of the coughing reflex. Chest x-rays show edema produced by irritation of air passages and appears as densities radiating from one or both hyla into dependent segments. Treatment is strictly supportive and includes correction of hypoxia, control of secretions, and replacement of fluids. Further infection is treated with antimicrobial drugs, Viral interstitial pneumonia is most commonly caused by influenza. It is more common than bacterial, but less severe. Diagnosis is based on clinical findings and serologic tests. Radiographic findings are not very helpful in this case. Symptoms include a dry cough and a fever. Treatment is focused on relieving symptoms because viral infections do not respond to antibiotics. We are going to move on to COVID-19. COVID is a severe respiratory distress syndrome. It is easily transmitted from human to human by the respiratory system through droplets from the nose and mouth. Symptoms can appear between 2 and 14 days after exposure, including a cough, shortness of breath with difficulty breathing, fever, and a sore throat. Individuals can also be asymptomatic. The most accurate test for COVID-19 is the RT-PCR test. Imaging is not typically indicated in individuals with this disease unless they are experiencing worsening respiratory symptoms. The primary findings on X-rays and CTs are pneumonia. Alright, this is another highlight star. Bronchiectasis is an irreversible abnormal dilation of one or more large bronchi as a result of destruction of the elastic and muscular components of the bronchial wall. The most common symptom is a chronic cough in the early stages. As the disease progresses, the cough becomes more productive. If the disease progresses, the infection grows and destroys the bronchial wall, resulting in an abscess. Individuals may experience a chronic cough, but patients can remain asymptomatic. Individuals can also experience pleuritic pain, recurrent fevers, wheezing, and shortness of breath. A chest X-ray demonstrates increased bronchoscopy marking and parallel lines outlining the dilated bronchi, which are called tramlines. A high-resolution CT is the modality of choice to visualize the disease. Pulmonary tuberculosis, or TB, is an infection caused by the inhalation of Mycobacterium tuberculosis. It generally affects the lungs but can also affect the genitourinary system, skeletal system, and central nervous system. TB is more prevalent in people that are born outside of the U.S. Early pulmonary tuberculosis is always asymptomatic and may be identified only with a skin test. Signs appear when the lesion or nodule scars are large enough to be seen on a chest X-ray. Lesions are mostly seen in the apical region of the chest, so a lordotic projection of the chest is useful in evaluating TB. The primary way to identify it is from organisms from sputum culture or by an intradermal injection. Symptoms include a chronic dry cough. In more severe symptoms, the patient presents with malaise, fever, weight loss, and blood-tinged sputum. Fibrocaseous TB occurs in patients who have active signs of tuberculosis. Necrosis is a prominent feature of the disease because it infiltrates and affects the lung parenchyma. This infiltration may expand and produce the formation of a cavity. If the cavity is spread to the bronchus, then the bacteria are spread throughout the lung. Dormant TB can reactivate, and these individuals are susceptible to military tuberculosis. That is when large numbers of bacteria are picked up and carried by the bloodstream through the body. Highlight star. Military TB has its name from its resemblance to the millet seeds, which are small white grains. Military TB is captured by macrophages within the alveoli and created a cell-mediated immune response that infiltrates the lymph nodes. A chest X-ray would be done if TB is suspected. CT images can also be utilized to visualize disease involvement and progression. The tuberculin skin test is used to detect and screen asymptomatic infected individuals. Treatment of TB includes long-term antibiotic therapy, good hygiene, mask wearing, and isolation. In extreme cases, surgical resection may be performed to eliminate bacteria. Alright, another highlight star. Chronic obstructive pulmonary disease, or COPD, is a group of disorders that causes chronic airway obstruction. The two most common types are chronic bronchitis and emphysema. This disease is irreversible and results in limited airflow. In the case of emphysema, decreased elastic recoil of the alveoli will occur. Over the past 20 years, there has been an increase in mortality rate of COPD, and it is now ranked the fourth most common cause of death in the U.S. Risk factors for COPD are cigarette smoke, air pollution, airborne chemical fumes, and inhalation of hazardous dust. Chronic bronchitis is caused by long-term heavy cigarette smoking or prolonged exposure to high levels of industrial air pollution. Symptoms include a persistent cough and increase in the production of mucus or phlegm. The disease progresses slowly over months and years that gradually result in bronchial obstruction from excess secretion of mucus. Eventually, the lungs remain in a chronically inflated state because more air is inhaled than exhaled. On X-rays, the lungs will have an appearance of hyperinflation. Treatment is eliminating the causative agent like smoking, pulmonary rehab, antibiotics, bronchodilators, and oxygen therapy. Emphysema is a condition in which the lungs' alveoli become distended, usually from loss of elasticity or interference with expiration. It is characterized by an increase in the air spaces distal to the terminal bronchioles, with destruction of the alveolar walls. The primary symptom is dyspnea. In early stages, radiographs show normal results, but over time, hyperinflation results. Emphysema appears on an X-ray as a depressed or flattened diaphragm, abnormally radiolucent lungs, and an increased retrosternal airspace like a barrel-shaped chest. Emphysema is a destructive disease to X-rays, so we would need to decrease our exposure because of the increase in aeration of the disease. Smaller lesions are best demonstrated by CT exams of the chest. Treatment for emphysema is to alleviate the symptoms by treating any reversible elements and prevent further progression of the disease. A disruption in the esophagus or airway may result in mediastinal emphysema. This is a highlight star. I just forgot to say that at the beginning. Alright, a lung abscess is a localized area of dead or necrotic lung tissue surrounded by inflammatory debris. Causes of a lung abscess could be a periodontal disease, pneumonia, neoplasms, or other organisms that infiltrate the lungs. It will manifest as a fever, cough, coughing up pus, and foul sputum. Radiographically, they appear as a lobar or segmental consolidation that becomes globular in shape as pus accumulates. It can also appear as a round, thick, walled capsule containing air and fluid. CT may be used to provide more detailed information and detect any cavity formations. An empyema is accumulation of pus in the pleural cavity. Treatment of an abscess and empyemas focus on treating the primary condition causing it. Other treatments involve antibiotic therapy, chest physical therapy, postural drainage, and possible drainage of fluids through bronchoscopy. Surgery may be necessary if an abscess is resistant to antibiotics. Alright, this is another highlight star. The next inflammatory disease we are going to talk about is pleurisy. Pleurisy is the inflammation to the pleura. This can indicate that there are other diseases present. Chest x-rays don't demonstrate pleurisy, but they can confirm the presence of pleural fluid, which is associated with this disease. It is not an additive or destructive pathologic condition. Diagnosing and treatment of any underlying condition are important in relieving the symptoms of pleurisy. This is another highlight star. Pleural effusion is the general term to describe the abnormal collection of fluid within the pleural space. It should be considered more of a sign of an underlying condition than a disease. This is most often caused by congestive heart failure, but may also be caused by inflammation, pleurisy, a PE, or a neoplasm. These pleural effusions are termed exudates because they are a mass of cells and fluid that has seeped out of blood vessels or an organ. Pleural effusions may also result from microvascular changes such as those with heart failure or ascites, and those are termed transudates. A hemothorax is a pleural effusion containing blood and most frequently follows trauma to the thorax or thoracic surgery. A chest x-ray is commonly used in the diagnosis of pleural effusion. The signs include a blunting of the costophrenic angles, which is demonstrated in an erect lateral chest X-ray. A lateral decubitus X-ray is also valuable because they can demonstrate smaller amounts of fluid. Because of the excess fluid, pleural effusion is an additive pathology, so we would want to increase our technique. Treatment is to address the underlying pathological condition. Thoracentesis or other interventional techniques may be used to remove excess fluid to alleviate symptoms. This is another highlight star. Sinusitis is an infection and inflammation to the paranasal sinuses. This follows an acute viral infection, and the ethmoid sinuses are mostly affected because of their proximity of the nose. Common causes include streptococcal, pneumococcal, and staphylococcal bacteria and H. influenza. Symptoms of sinusitis include nasal discharge, headache, tenderness in the affected area, toothache, and general malaise. CT is the modality of choice as it demonstrates the swollen mucous membrane and retained exudate caused by infection. If we were to take an X-ray, it is an additive pathologic condition, so we would want to increase our technique. Treatment typically involves a saline nasal spray, antibiotic therapy, and analgesics for pain relief. Alright, next we are going to move on to neoplastic diseases, starting with bronchial carcinoid or adenoma. It is usually considered benign, but included in WHO's classification of lung cancer because they invade local tissues and sometimes metastasize to regional lymph nodes, so they are treated like malignant neoplasms. They are a rare disease. Adenomas are slowly growing and asymptomatic. They'll appear radiographically as an opacity and show a bronchial obstruction, overinflation of the lung, and atelectasis. CT scans of the lung can further determine the extent of the disease and identify smaller lesions. If it is discovered before metastasis, surgical resection may be curative. Alright, this is a highlight star, just so you know. Bronchogenic carcinoma is the most fatal primary malignancy in the U.S. It accounts for 90% of all lung tumors and has a very low 5-year survival rate. There are also 4 main types. They are squamous cell carcinoma, adenocarcinoma, undifferentiated large cell carcinoma, and undifferentiated small cell carcinoma. These arise from epithelial tissue in the major bronchi near the hilar region and metastasize via the lymph nodes, the bloodstream, or both. The radiographic appearance is an obstructed airway caused by a unilateral hilar mass. The lesion must be large enough to be visible on a radiograph. Adenocarcinomas show as a solitary radiopaque lung nodule, sometimes called a coin lesion. CT is essential in demonstrating smaller nodules, which would be less than 6 millimeters. Lung cancer prognosis is very poor with a 5-year survival rate of 20%. Treatment includes surgery, chemotherapy, external radiation therapy, brachytherapy, or any combination of these modalities depending on the type, location, and stage of disease. Alright, pulmonary metastasis is much more common than primary lung neoplasms. Most common sites are breast, GI tract, female reproductive system, prostate, melanoma, and kidneys. Malignancies can spread to the lungs by 5 different routes. They are through the bloodstream, through the lymph system, by direct extension and local invasion, through the tracheobronchial system, and by direct implantation from biopsies or other surgical procedures. Radiographically, these lesions appear as single or multiple rounded opacities through the lungs. CT is more sensitive than conventional chest X-ray in the detection of small metastatic lesions. Alright, so this is the end of my PowerPoint. Please let me know if you have any questions. I feel like I covered the highlight stars as best my ability. The test has 25 questions, I believe. There are a couple, like 2 short answer, maybe a true and false, otherwise it's all multiple choice. So please reach out with any questions.